You're watching Wisconsin Eye, an independent, nonprofit public affairs network, engaging the citizens of Wisconsin since 2007 through access to government proceedings and public policy events. You're watching Wisconsin Eye, an independent, nonprofit public affairs network, engaging the citizens of Wisconsin since 2007 through access to government proceedings and public policy events.
Session day as we talk about things that are important in healthcare. So we have some business to take care of first. And many of you know our Assembly Chief Clerk retired at the beginning of the session. So we are electing a new Chief Clerk today, Ted Blazel, who was the Senate Sergeant at Arms. That'll be one of the first things that we take up today. There's a bipartisan resolution authored by myself and Representative Hintz to message that election to Governor Evers and to the State Senate. So that'll be the first thing we take up. But today we are talking about some very important healthcare reforms. If you remember last year, the Assembly was successful in passing a really significant PBM reform bill. Unfortunately, that never made it through the state Senate. So to talk about what's in there again today, who's really been a champion on this issue, there's probably nobody that's worked harder on this topic of healthcare reform, especially dealing with prescription drugs, than Representative Schross. We'll let him talk about what the specifics are inside today's PBM reform bill.
All right. Thanks, Robin. Hi, everybody. So the bill that we have up today, PBM reform of pharmacy benefit managers, is pretty much the exact same bill as we had last session, except for some changes in the effective dates. What this bill basically does, it requires PBMs to be licensed, and they will be regulated by OCI, or the Office of Commissioner of Insurance. End result of that happening, I believe, is better patient outcomes, or i.e. hopefully lower prescription drug costs. There are 3 major PBMs in the country. They control about 80% of the prescription drug market right now. You have Express Scripts, OptumRx, and CVS Caremark. And they're vertically integrated companies. In other words, insurance companies own PBMs, PBMs own pharmacies, so it's a complicated mess to try to get any reform to happen in that area. 40 states have started or have already done some sort of PBM reform. So just a couple of quick things that are in the bill. Number one, it requires the PBMs to be licensed with OCI. Number two, PBMs must submit annual transparency reports regarding the kickbacks that they get from drug manufacturers. That's not going to be open to the public, but OCI will have records of those transactions. And it gives certainty to pharmacies participating in a preferred network. Number four is something that was done federally, but we're codifying it in state statute regarding the gag clause or disclosures. It also clarifies drug substitutions and formulary changes. And then finally, it gives some guideline regarding audits that take place. We found out during COVID that was held off for a couple months, but now these PBMs are back in with some of the small town pharmacies doing these audits that can amount to $100,000 to $200,000 per pharmacy. So that's it. Pretty simple bill. It passed, as Robin said, unanimously last year in the Assembly, and just died as one of those bills that never got taken up because of COVID coming. So, any questions?
Is there language in there on the DIRs? Because I was talking to a pharmacist who was hoping that would also be included, if not in this bill, at some point down the line, because he felt like that was something that was really stinging them, was having to watch over their shoulder about getting dinged on those audits.
Yeah, there's language. I don't know that it's going to make the pharmacies 100% happy because of some of the compromise we had to do. But there are some things regarding DIR fees that won't go into effect until January 2022. Okay.
Thank you. The next bill we have up regarding the practice of healthcare providers in other states is a bill author, Representative Vandermeer. There are other provisions in the bill, and I'll let her take a minute to just describe what those are.
Thank you. Good afternoon. The bill that I'm going to talk about today is AB 148, and some of you may be familiar with those provisions. They were introduced in AB 1 earlier this session. So there are 5 areas, as the speaker indicated. One would be to permanently allow our state health providers to start practicing in our state, providing that they have no concerns in the current state that they're practicing. And I was very pleased to be able to author this because during a pandemic, It's so important that we have access to the practitioners we need. This includes a variety of 15 different practitioners, including physicians and various therapists that operate in our healthcare setting. So we well know that the sooner and more access that we have for our patients here in Wisconsin, the better their outcomes are. So I was very pleased that throughout all 5 of these provisions that I'm going to mention today, we've had very good bipartisan support from the Senate, from the governor's office, and of course in the Assembly. And I want to thank the Health Committee that worked with us on this as well, because it passed out of the committee 15-0. When I talk about the healthcare providers and getting them into place into the healthcare settings with our patients, as you recall, in the past, I have also authored the Interstate Medical Licensure Compact and the Enhanced Nurse Licensure Compact. Being on my local hospital board, this is very important to me because sometimes credentialing can be a very slow process. And once again, it impedes that process of getting that significant practitioner to get to that patient for the best outcome. So I'm really very pleased with that. The other areas that I wanted to talk with, of course, is having the availability of more Medicaid claims data to develop more insight into how our patients are doing in Wisconsin. And of course, that's once they leave the hospital and how they respond in the clinical setting so that we can continue to have better outcomes for them and identify maybe where gaps may exist. And then, of course, another almost kind of revolutionary program that's available is enabling Wisconsin to participate in the CMS Hospital at Home program. And I want to make sure that you understand this is not a home care program that we may be familiar with, but this is actually bringing the technology and the professional services into a patient's home so that they usually will do better at home. Right now, studies have shown that there's 60 different diseases that can be treated in the home setting with the technology that is available. In order for a patient to take advantage of this program, they have to pass an inspection at their home as well. So I have great support, Gunderson Health in La Crosse, as well as Mayo in my district. They support this program. And then already we have Marshfield Clinic and Mayo and Eau Claire who are approved to use this program. Also, we have payment for outpatient services available to hospitals. Many times during the pandemic, there were patients that were not able to get those non-COVID assessments. And so many times Medicaid would not be able to pay for it because it would be out of the, say, address of the hospital that would have been providing that particular diagnosis. And so this allows those assessments or diagnostic procedures to take place before they may stage into something much more serious. So I want to say once again, I'm excited about this bipartisan legislation that I brought before you today, and I'm very thankful to all the stakeholders that worked with us on it.
Many of you know that we have had a long passion for dealing with mental health in the Assembly Republican Caucus. We actually created a special committee that has done really good work on mental health. One of the bills that they passed last session was authored by one of our members here, so I wanted Representative Tittle to talk about the other bill on the calendar today dealing with psychologists.
Thank you, Mr. Speaker. Yeah, this bill basically, it's about 5 years in the making. We worked with the psychologists all over the state of Wisconsin, and we're reforming what the Psychology Examining Board does for licensing. One of the great things about this bill is actually it creates a interim license, because as you go through the psychology program, after you've gotten your doctorate, now you have to get 2,000 hours of counseling in, under supervised from a psychologist. This will allow them to get an interim license, start billing, and start working towards getting their permanent license. So I think that's one of the highlights of it. We've worked with psychologists all over the state of Wisconsin. to reform this. And as we know, with COVID, there's a greater increase for people in need of mental health services. This is going to help get more people on the front lines helping. So, any questions? Thank you.
The last bill that we're going to highlight today also deals with healthcare. It's authored by one of our new members, Representative Moses of Menominee, New Richmond area. It's dealing with giving dentists the ability to administer vaccines. Representative Moses.
Well, thank you. Good afternoon. Once again, this is all about getting more hands on deck, getting more providers out there where they're needed. This pandemic has proved very challenging throughout the state, especially where I represent up in the rural part of Wisconsin. AB 13 actually puts more vaccinators out there by allowing our dentists who are already qualified and well within their scope of practice, who are already doing nerve blocks, anesthesia, you name it, to basically put more shots in arms for those that want it. So it's going to allow more people to get access to the vaccine that is out there. It also goes beyond just COVID. It also covers flu vaccines as well, which is something that a couple neighboring states, Illinois and Minnesota, are already doing. So with that, I'm very excited about this one. This, again, is a bipartisan effort, should receive support from all of us. So thank you.
All right, with that, we're happy to answer any other questions you might have.
Members of the Black Caucus were frustrated that there wasn't a resolution for Black History Month. We're taking up this resolution honoring Rush Limbaugh tomorrow. They are upset about that in part because he did that with other resolution. Can you state why you think it's a good idea to take up the one but not the other?
Sure. We actually negotiated with members of the Black Caucus. My hope was to actually bring up a resolution. Some of the names that were in there, and it's always challenging when you pick out a number of individuals to represent a class or a group of folks. So the idea of picking out folks who potentially had people in our caucus had concerns with, we asked them to do one that was more generic, the ones that we had done in the past. They really didn't want to do that, so we never reached consensus to be able to say, here's one that hopefully could reach that broad bipartisan support. Members have the right to bring a resolution forward for any one individual. That's usually easier because obviously you have a positive or negative on one person. So that's why we decided to put the calendar on for Rush Limbaugh. Members in our caucus asked for it. There was not a lot of controversy on our side, so it allowed us to be able to bring that forward.
Who from the Black History Month resolution was a concern to the caucus?
Honestly, I don't have it in front of me. Yeah.
So one of the members that was named on the original list of people they identified in that resolution was Khalil Coleman. Khalil Coleman has been arrested for burglary and I believe attempted murder or murder in Kentucky. Don't quote me on that. I think that's where it was. So that was one of the individuals. There were others as well that participated, the People's Revolution, that participated in the assault on Officer Mensah's girlfriend's home, where there were obviously some pretty significant issues. So those were the kind of issues that some of our members had concerns with.
Do you intend to pass another prevention of the 1 week extension of the unemployment benefits in order to receive federal dollars from the latest stimulus?
We haven't talked about that as a caucus, but I will say this, that the biggest concern that I hear from folks is the fact that we have a lack of people applying for open positions. I know in discussions that I've had in my own district, the fact that people have been getting these large deposits into their checking account has made some folks suspend their own search for work as they have money in their checking accounts. They're not looking for a job. So I think the problem is not the suspension of the 1 week waiting period. It's getting more people into the workforce to fill the huge number of jobs that are going unresponsive to employers who need folks. If you talk to especially those people who are in high demand, or those jobs that are in high demand in manufacturing, in production, in the retail setting, especially grocery stores and that, they still aren't able to find enough folks to fill their open positions. So I have concerns that just extending the 1 week waiting period and not allowing folks or not having the requirement in place that people have to look for work to not just stay in unemployment is having an unintended consequence. Our unemployment rate is already somewhat similar to where it was pre-pandemic. I think we're below 5%. So I don't think the problem any longer is folks being able to access the system to be able to have the 1 week waiting period. It's getting people back into the workforce to be able to find a job. But we haven't talked about it, so I can't say what our caucus position is quite yet.
If I understand correctly, you're considering not taking the additional $300 per week for unemployed?
No, that's under the federal bill, right?
I
So.
thought that under the federal bill, don't you only get that money if you extend your 1 week waiting, or suspend the 1 week waiting period again?
Well, that's what we're waiting on, the final. We asked for a memo from Ledge Council to confirm exactly what's required and what is not. So that'll be one of the things that we look at. But again, the challenge is we are now seeing in some circumstances people are being paid more to not work than they are to actually go and find a job. So knowing that we have a shortage of people out there working, it's a concern to a lot of us, myself included, that we are creating a disincentive to work so that if you are in the workforce and you are working 40 hours a week, you are earning less than somebody who chooses not to look for work, who's getting the bonus federal unemployment. So that's not a system that Republicans want to stand behind, but we certainly want to make sure that we have all those answers and talk about it as a caucus before we make a decision.
Thanks, everyone.
Okay, thank you.
Wisconsin Eye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. Wisconsin Eye is the nation's first and only independently funded state civics broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.